make your life easier. Moms Every Day.
Welcome to Moms Every Day. I'm Katie Wilson. Today we've got Lisa Hastings and Christy Franklin from St. Mary's Medical Center. Thanks for being here, guys.
Thank you. Thank you.
Yeah, so today we're talking about a special event that really celebrates a healthcare milestone. So before we talk about, the reason behind the event, let's talk about the when and the where.
Okay. Saturday, June the 22nd, we're going to start at 10 a.m. It'll be at our Centers for Education on the corner of 29th Street and 5th Avenue. From 10 to noon, we'll have many displays, vendors to share with us information about stroke and rehab and stroke care. We'll also be doing blood pressure screenings and stroke risk assessments. We'll have some light refreshments. We will have the helicopter will be there, the HealthNet helicopter, and Cabell County EMS will be there with an ambulance.
Great. And I understand this is celebrating the 20th anniversary of a very specific procedure. So let's talk about that.
Okay, well, back in the late 1990s, the only stroke treatment at that time was newly released was IV TPA or Activase. There had been a recent study using a clot retriever similar to that going actually into the vessel, into the brain, and dissolving the clot. And in 1999, we at St. Mary's did the very first procedure of that type on a young patient. And she did a wonderful recovery. And actually on Saturday, she will be there not physically, but she'll be there through Skype because she's a nurse and she's in Chicago.
Wow.
So she'll be visiting us, through the video.
Yeah.
And her physicians will be there speaking as well, Dr. McComas and Dr. Corona, who took care of her during that procedure.
Awesome.
And so since that time, in those 20 years, there have been some great advances in stroke care.
I can imagine.
And TPA is still the only FDA-approved medication for IV for dissolving clots. However, there's a lot of new devices that have came about on the market. A lot of research has gone into those, and over those 20 years, that technology has improved greatly. So we're celebrating that 20 years of all those improvements and really the outcomes that are available now for our patients.
And I'm sure this would just be so not only eye-opening but useful, especially for patients that have had strokes, just to go there and learn what their options are now.
Absolutely.
Yeah, so this is sponsored by the Total Woman, but this is not just for women, correct?
Exactly, yeah. The Total Woman program is sponsoring Saturday's event, but it's free and open to the public. And like I said, from 10 to noon, we'll be seeing all the vendors that are there, and then at noon, our speakers will start. And it's just going to be a great way for people to learn about stroke itself and how they need to act fast to get the care that they need.
Yeah. How do you think that this procedure that we're talking about, how has that impacted stroke care?
Well, there's been many benefits, but one of the great advantages is that it can be done in a longer window. With the IV medication, you have a short window of time that is safe for that medication to be given.
Right.
With the retrieval devices now, we have a longer time frame. You still want to get to the emergency room and get treatment immediately because sooner is better. But if for some reason it's not, they aren't able to get there in time for the IV TPA, these treatments can be done for several hours after the stroke. If there's a clot, it identifies the clot and they can pull it out.
Got it. So again, if you know anybody who's had a stroke or you have yourself, this event seems like it would be very not only interesting but useful for you. So again, let's just go over the details real fast.
Saturday, June the 22nd, we're going to start at 10 a.m. 10 to noon will be our vendors, and at noon our speakers will speak.
Perfect. Well, thank you guys so much for being here. We really appreciate it. And again, you guys can watch us on WSAZ.com. Just click on the Moms Everyday tab. Have a great day.